Governor Polis says the state is on track to have 70% of Coloradans 70 and older vaccinated by the end of the month. As more people get inoculated, we want to be sure to get all of your vaccine questions answered. CBS 4 medical editor Dr. Dave Hnida is here. And Dr. Dave, we heard you just got your first dose of the coronavirus vaccine. So tell us, how are you feeling?
Actually, pretty good. Sore arm, a little bit of achiness, a little bit of a headache, but certainly nothing that is not fixable with a little bit of Tylenol before bed. Functioning well, and I think, more than anything else, just a feeling like a lot of people get after they are vaccinated, and that is mentally, you just feel much better that you are finally doing something that will just take all of us back to a little bit more of a sense of normalcy at some point. Like we've been saying, I've been vaccinated now. I still have another vaccine that I need to get full immunity, but I'll continue to mask and social distance and do all the things that we continue to ask people to do after they do get their vaccine.
Great. Yeah, it was wonderful to hear you got that first dose. So tell me, I've heard a lot of different things about people's reactions. Some have some pretty severe reactions, some feel fine. Is someone's reaction to coronavirus vaccine an indicator of how well you're protected, or does it mean anything like that?
Not really. Probably about 2/3 of people do get some sort of a reaction. They will wind up getting a sore arm, a little bit of a fever, or some achiness, headache, so on and so forth. But about 1/3 don't. But the big thing to realize is that the level of your reaction in no way, shape, or form is a reflection of just how strong your immune response is. Now, I wound up getting sore arm, achiness, and so forth, and so I know my immune system is kicking in. But I do also know, by looking at the studies, that when they did the research trials on the Pfizer and Moderna vaccines, that many people did not have any sort of sore arm, fever, chills, aches, and so forth. But yet, those people still got the same level of immunity as people who did wind up having some sort of a reaction. So those folks were 95% protected against coronavirus, and they were 100% protected from going into the hospital and protected from death from COVID. So certainly your level of reaction does not necessarily indicate just really how robust your immune response is. One very quick caution here for folks too. Some people have said, well, I'm going to go get a COVID antibody test to see if my vaccine was effective. Those tests really are not very valuable in terms of assessing your COVID vaccine response. They are tests that check for different antibodies and really are not helpful at all. You get the vaccine, you will be considered protected.
That's very interesting. I hadn't heard of people thinking about that yet. Great information. Well, last week the CDC announced its guidance to get kids back in school, and Governor Polis says the benefits of getting students back in the classroom really far outweighs the risks. What do you think about that?
Gosh, all of us know how important it is to really get the schools reopened. And we do know that schools in and of themselves are not big drivers of infection. They're not COVID factories, so to speak. But yet you look at the effect of what really has gone on with kids over the course of the past year. They've lost a year of effective learning. They've lost a year of living, socializing with other kids. And that's to say nothing of the parents and the sacrifices that they have had to do to help their kids out. Now, the CDC has put out a framework and guidelines, including masking and distancing and so forth. Colorado, we're already doing those things. We are also doing a few extra steps, including vaccinating teachers and staff, which is hugely important in the equation, in my opinion, on this sort of situation. I think it really will go a long way in protecting a very potentially vulnerable population. So I think it's a great idea. And once again, Colorado is ahead of the curve on that. I think that really we have a really good program here in Colorado. I think it's really going to be important, though, to take a look at just the concept of what's going on in the community. Our numbers are down, which is great. They're not as good as they could be. And I really think that we do need to continue to drive our community numbers down if we want to get the schools reopened.
Great, that's wonderful. And so pregnant women are also currently being told to consult with their doctors before getting the coronavirus vaccine. What has the research shown so far about the vaccine in pregnant women?
It's actually been reassuring. There's not enough research as we would like at this point in time, but there's a couple things to consider. When you take a look at the Pfizer and Moderna trials, there were women who were vaccinated during the trials and then went on to become pregnant. And they wound up having very good pregnancies and good outcomes, healthy children after receiving the vaccine. So we know that at least in those women, the result was very good and it was safe and it was effective. We also know that at this point in time, probably about a little bit more than 10,000 pregnant women have been vaccinated here in the United States against COVID, and none of those women, zero, have had any issues with problems with their pregnancy as things have gone along. And so take that in combination with the fact that we are currently beginning to do some research in a lab setting, and then we'll progress along to testing in pregnant women. I think we'll get more and more vaccine information in terms of safety. I think at this point, the advice remains the same. Obviously, talk to your physician about this. We do know that COVID is devastating in pregnancy potentially. And even though right now I think things are kind of in a yellow light caution phase, I think that as we learn more and more, it will become almost like it is with a flu shot. It will wind up turning into a more of a green light type of go ahead and be vaccinated and feel confident that you are protected and your child will be well.
Great, that's wonderful. I know that's been a big question. Well, thank you so much for joining us today, Dr. Dave, and we'll talk to you again next Monday at 11 a.m. to get more of those coronavirus vaccine questions answered. So we'll be right back.